Bridge Network, and he's going to be introducing us and welcoming us here today. So Emmanuel, I'm going to pass it over to you.
Thank you, Maddie. Hello, everyone, and again, welcome to this evening's session. This is the briefing session on the Physician Pathway Law. It used to be a bill, but now it's the law of the land of Massachusetts after the governor signed it into being. So, which is really great. It's a good news for all of us who are in this space. And this is the point you may want to share. You could put your excitement in the chat there, show how excited you are, because the law we have today have taken us 10 years into getting us to this point. And I want to use this occasion to say thank you to everyone who is on the call today and those who are not on the call for keep working on this bill and for bringing us to where we are today. And then also I want to say thank you to the team at MIRA and ABN for coordinating these sessions with us. So you realize this is really 1 hour session, and the plan is this will not be the only session. This is only to do a briefing, highlight the key points of the law, and also answer questions that we have received since the law came into effect. The plan is we will continue to hold future sessions as we develop the law into programming. So, and I need to make this point clear. We live in an age of information. So that means different informations are going to be put out there. And I will really urge you to be careful. If you are not getting the information from ABN or MIRA, you really want to check. If you hear anything new about this bill and it's not coming from us, you want to be careful about that. A few things I want to point out. Tonight, we're going to have 2 presenters. And when they are presenting, you can use the chat to put in your questions or your comments. And when they are done, we'll do our best to answer any outstanding questions for you. We did receive a lot of questions through the registration, and we will try to answer many of them as the presentation goes through. But just for some reason we don't get to your question, we'll give you the chance to ask it at the end of it. We are expecting about 500 people to tune in either via the Zoom platform or watch through YouTube. So please, as much as possible, mute your mic so that we don't get background noise from you. With that said, I would love to introduce our 2 speakers, and these are people who have been working on the bill, so they know the bill in and out. The first person is Amy Grander with MIRA. So MIRA is the Massachusetts Immigrant and Refugee Advocacy Coalition. Amy serves as the state legislative director, and Amy was also appointed to the Massachusetts Special Commission on Foreign Trained Medical Professionals. And it is this commission that helped develop the framework for the now Physician Pathway Law. In addition to Amy, we will have Dr. Rob Marley, who is the Chief of Mental Health Center at Lowell Community Center. And he also served as a special advisor to MIRA on healthcare workforce issue. Dr. Marley also served on the commission with Amy as well. So from their background, you get a sense that these are 2 people who knows the new law in and out. And we are really happy to have them join us to share with us the highlight of the law and help us find answers that we may have. So with that said, I want to invite Amy to kick us going. Thank you.
Okay, good evening, everyone. I'm just testing my screen here to see if it works. Let's see. Yeah, so I'm having trouble with the screen advancing. Okay, I have to do it by finger. So yeah, so the purpose of today is, well, first of all, let's say, so Massachusetts became the 10th state to passed legislation that with a pathway for permanent licensure for internationally trained physicians by removing the residency requirement that is now required in, I believe, almost every state, probably every state in the country. So the purpose today is we want to explain the new law for the benefit of all of you internationally trained physicians who are seeking to practice medicine in Massachusetts. And so today what we're going to cover is the eligibility requirements that are in the law and the steps to full licensure that are also in the law and the expected timeline for implementation. Once legislation is passed, it takes a while to implement. We have to await regulations from the Board of Registration in Medicine, et cetera, and that process takes a while. Meanwhile, though, there are some things that you can do to prepare. The other thing I wanted to say is with regard to questions, we know there's a lot of questions and there are a lot of folks here on the Zoom, and we're grateful that you're here. But because out of respect for the international physicians themselves, we want to prioritize the questions from those physicians. And so those are the folks that we're going to be asking. Those are the folks that are going to be offering to answer questions too. So in summary, as you know, the Physician Pathway Act will mobilize your expertise to address physician shortages in Massachusetts by creating a pathway to full licensure in exchange for at least 3 years of medical practice in an underserved community. The way that the law works is the law lays out a pathway that encompasses 3 steps to full licensure. To begin, the pathway starts by allowing eligible internationally trained physicians to be issued a renewable 1-year limited license to practice medicine under the mentorship of a participating health center or hospital. Upon successful completion of that mentorship, the internationally trained physician will be eligible for a renewable 2-year restricted license to practice in a shortage area or specialty in Massachusetts. And then the physician will be able to apply for a full unrestricted license to practice medicine anywhere in the state. Each of these licenses, the 1-year limited license and the 2-year restricted license, are each renewable once. So the state will have 3 to 6 years of medical practice in areas serving people with the greatest need. I know you're all aware that we have a physician shortage here in Massachusetts and in the rest of the country. So the state legislature was very interested in mobilizing your skills. So I mentioned earlier that the limited license is a license to practice under the mentorship of a federally qualified healthcare center, community health center, or hospital approved by the board. So I want to say a little bit about the mentorship program. So this is the program that's an alternative to the current requirement for residency. It's different from a residency. It's not supervised. It allows a physician to practice independently under the mentorship of this facility, of a participating facility. So the Physician Pathway Act defines internationally trained physicians as physicians who've been previously licensed or otherwise authorized to practice abroad and who have a year or more of independent practice experience abroad. And as I don't have to tell you, the slide says this, but you all know that the residency requirement is the greatest barrier to practice faced by all of you because you have to compete with recent medical graduates for a residency match. So again, the Physician Pathway Act removes this requirement. And instead, the pathway substitutes a 1-year assessment and evaluation program by the participating healthcare facility where the internationally trained physician would practice under the limited license. And you'll see a lot of references to ITP. That's short for internationally trained physician, and it's easier to say. So I'm going to start saying that, ITPs. So during the mentorship program, the participating facility will develop and evaluate the ITP's familiarity with non-clinical skills and standards appropriate for medical practice in Massachusetts. Let's see what I can do here. And a little bit about who are these participating healthcare facilities. So these, the law sets out that they can be they have to be a federally qualified health center, community health center, hospital, or other healthcare facility approved by the board. So now we're going to break down a little bit and look at the steps. So again, here, the 1-year limited license authorized the ITP to practice medicine in a participating healthcare facility approved by the board and is renewable 1 time. So here's the eligibility requirements. This is set forth in the law, and these are basic requirements that everyone will have to fulfill. So to be eligible, the physician must have graduated from a legally chartered medical school outside of the United States that's been recognized by the World Health Organization. 2, they have to have been previously licensed or authorized to practice outside the US and have practiced independently for at least 1 year. 3, the physician has to obtain a valid certificate from the Educational Council for Foreign Medical Graduates? Do I have that right, Rob? Yes. The ECFMG, or other credential evaluation service approved by the Massachusetts Board of Registration in Medicine. So there may be other ways or other certifications that get approved by the board. 4, they have to, in order to participate, they have to have obtained a passing score on step 1 and step 2 CK of the US medical licensing exam. And then finally, and this is important, step 5, they have to have been accepted into a program with a participating healthcare facility and have an offer of full-time employment under the limited license. So the step would be that the facility and the physician, once they're in agreement and accepted into the program, would apply together for the limited license. Once the limited license is, once the person has practiced under the limited license for a year, then they become eligible for a 2-year restricted license. And what this license does is it authorizes the physician to practice independently in a physician shortage area and specialty that are designated by the Board of Registration in Medicine. And that license also is renewable 1 time. To be eligible for this second license, the physician must have successfully completed the participating facilities assessment and evaluation program, the mentorship program that I mentioned earlier, and they have to have obtained a passing score on step 3 of the US medical licensing exam. So during their mentorship, they would likely at that point take the step 3 exam. And then they have to fulfill any additional criteria that the board may require. So the law does allow the board to add criteria. They're unlikely to add very much. The law is pretty specific. However, they are allowed to add criteria, but they're not allowed to add postgraduate clinical training. That's the point of this law, is to remove that requirement, the residency requirement. And then after 2 years of practice under the restricted license, the physician would be eligible to apply for a full unrestricted license to practice anywhere in Massachusetts. So that's the basic framework that's outlined in the law. What makes this bill, so I mentioned earlier, we are the 10th state in the country to remove the residency requirement for experienced internationally trained physician. We were the first bill in Massachusetts was the first state to actually have a bill filed like this, but 9 other states beat us to the punch by actually passing their legislation before we did. The laws are all in the other states they vary. They all remove the residency requirement, but they're different in a lot of ways. They're not identical laws. What's distinctive about the Massachusetts legislation is that it has a service requirement because it requires participating physicians to practice for at least 3 years in underserved communities before they're eligible for full physician licensure. It's clear that some of the state laws, it's not clear they mention supervision. And again, to us, when we think supervision, it means a residency, and we're removing that requirement. So it's very clear in our legislation that the ITP is practicing independently while being familiarized with Massachusetts and US practice, the US practice environment. So the idea is to increase the facility's capacity to take new patients and to allow it to bill for the physician's work. Another piece is that there's no look back period. So some states limit eligibility to physicians who have practiced in their home country within a set prior time period. For example, some states require them to have practiced in their home country sometime in the last 5 years. The Physician Pathway Act does not do that. It does not have a look back period. And this reflects the actual experience of physicians in the US who invest significant time and money to prepare for the US medical licensing exams, often only to find out that, and apply for residencies only to find out that there are none available for them. Again, I'm having trouble advancing the slides here. Okay, so it's important to mention here that these physician licenses are not available now. The law was just passed on November 20th. And so there's several steps that the state of Massachusetts has to go through before these licenses can be available. So the first step is the Massachusetts Board of Registration in Medicine, sometimes called BORM, develops draft regulations that will identify the participating facilities or the criteria for the participating facilities and any new criteria for the physicians. But again, under the new law, any new criteria cannot include postgraduate clinical education. After they issue draft regulations, then there's a public comment period where the public can weigh in on the proposed regulations. They have to do that. And then the board will issue final regulations after taking those comments into consideration. For the part of physicians, in order for them to participate, the physician will have had to have been accepted into a mentorship program by a participating healthcare facility with the expectation of full-time employment by that facility. And then the facility and the physician will apply for the limited license together once they're available. And then once that physician's license is issued, they can begin to practice under the mentorship in that facility and under the mentorship of that facility. So here's what we don't know. We don't know when the limited license application will be available. Implementation could take as long as a year. We also don't know what, if any, additional criteria for eligibility will be required by the Board of Registration in Medicine for the 1 or 2 year license. We don't know what the board criteria will be for the facilities to participate in the program. And we also don't know the shortage areas or populations that will be designated by the board. It's up to the board and the Department of Public Health to determine where the state most needs the help of physicians, where they most need to build the physician workforce. And we also don't know the shortage specialties that will be designated by the board, although primary care and psychiatry are the favored. So primary care meaning internal medicine, family medicine, pediatrics, psychiatry. Those are the likely specialties. And then we don't know when employers and insurers will accept the Physician Pathway Act licensees for employment. I know you're going to have questions about that. You may have questions about all of these things, but there are things that we don't know yet, and we can't know until those regulations come out. So we'd like to open it up for questions from internationally trained physicians. I don't know, is it possible to spotlight me and Dr. Marlin to put us on spotlight here, and I can stop sharing my screen?
Yes, I can spotlight both of you.
There we go. Okay, here we go. Wow, I'm really blurry. All right. I'm going to go off my screen.
Oh, you muted yourself, Amy. Did you mean to mute yourself?
I
There you
meant
go.
to mute myself. I was trying to fix my image. I don't know
Oh,
why I'm so
no, it's
blurry.
fine. It's fine.
Okay.
We all have issues with our image, so.
Yeah.
So I think we'd like to take questions. I was reading the chat as we went. There were some basic questions that people asked about what is ECFMG and things like that. We'd really like to highlight specific questions from internationally trained physicians. I don't know if
How do we go
Are-
about that? Do we just jump on? Do we raise hand?
Yeah, Maddie, do you have way that you want to try to read things out, or do you want to ask people to raise their hand?
Yes, if you guys could raise your hand and we'll call your name out and then you can answer the question. So if anyone has a
Okay,
question,
cool. Thank you.
please. All right, I'm gonna start with Yasmin because I saw your hand go up first.
Hey, thank you so much for your time and the presentation. I just wanted to know like where we can start the application process since you said that it would take a year to have the law actually go through, and then how can we check the status update?
So the application process doesn't exist yet. So this is a law that was passed, and now we have to develop the regulations and the practices with the Board of Registration to have a system so people can apply, and at the same time develop the system for the healthcare facilities to host internationally trained physicians. So there's no way to apply right now. And that's where we want you to follow MIRA and ABN for updates about how you can do that. But we think it's going to take something on the order of a year to develop that system. We couldn't develop it in advance until the law existed, and now it exists. Many people will start working on that.
Thank you.
Sure.
All right, I'm actually gonna alternate between verbal question and then a question in the chat. So I'm gonna ask Elaine. She says, does this kind of pathway fit for psychologists slash neuropsychologists?
So again, for this evening, we are only talking about physicians. While we recognize the need for all kinds of healthcare professionals to be brought into the state in increased numbers, this law only pertains to physicians. As many as you know, licensure for every healthcare profession is different in the state. So the process for psychologists is different than it is for nurses than it is for physicians. So we addressed what we think is one of the more complicated ones first. So it's only for physicians. But we look forward in the future to all of you working on developing a process for other professions. But again, tonight and this law only pertain to physicians.
All right, so my next question, I'm gonna call on Carmelo. Here, I see you have your hand raised.
Hi, can you hear me?
Carmelo, you're a little bit muted. Buonasera.
Can you hear me now?
Yeah, go ahead.
Can you hear?
Yes.
Yes.
Yeah, okay. So congratulations, Hemi and Bob and all MIRA. So I think it's an amazing advance, in the field, really advanced. So however, my point is still with a little bit of concern. So I think all this policy of operation clearly, very clearly, is fighting discrimination. That is, we need to say clearly, and we are all happy about this. However, I think an ITP will feel bad, to go on USA to try to apply the PPA and start again to study biochemistry, histology, chemistry, biostat. So in other words, I'm saying the requirement of USMLE step 1, step 2, and also step 3 is still a major concern, in my opinion. So I know that these things are not done from night to morning, because it takes so much long time. So my only, comment and question is this. So is there any chance, in terms of legislation to amend or modify the requirement of the USMLE?
So not currently. So Camilla, I'm sure you'll appreciate that we have to work within the confines of what's legislatively possible and politically possible. So ECFMG and other bodies have within their guidelines that people have to pass USMLE. So if we put forward a bill that says no more USMLE requirement, even if we agreed with it, it would not have been passed because it's already a great step that we remove the residency requirement. And I think currently there is probably no appetite from what we've seen in legislation in other states and in boards of registration in other states to remove USMLE. I'm not saying it couldn't happen in the future, but we could not try to address all things in this law. And our primary goal was to remove the residency requirement because most people have said to us it's sorry, the biggest block to them. And also it's the most redundant because people have already trained. I understand the barriers that USMLE puts up. I understand the difficulties, but we just couldn't, there was no way to address that in this law.
Thank you, Rob. I'm gonna go over to Jose next. You can go ahead and unmute and ask your question.
Hi, good evening. Which are the other credential evaluation services approved by the Massachusetts boards? It's because I saw that there was a slide that said that there were other ways aside from the ECFMG initial certification to do at least the first year. It's because my school doesn't have the sponsor note from the ECFMG, so they don't even allow me to do examinations, which I feel like they kind of should, because that's the proof of like the whole point of me doing an examination, to prove to them that I have the skills. But I'm not even allowed to do that. So
Jose, can I ask what school you're from?
yeah, Universidad Autónoma de Durango, Campus Los Mochis in Mexico.
Okay. Just for our reference. So again, we're just starting to develop the regulations and policies for the board. So what we're saying is ECFMG is recognized and others that the board will recognize. There's no policy yet. So we can take into consideration what you're saying, and especially if there are other schools in the same situation, to advocate to Borum, to the board, that they consider it. So there's nothing solid there right now. So that's why it's a good time to bring up that kind of issue.
Yes, the sponsor note, they actually added that requirement this year, that they should all have the sponsor note, that it wasn't enough for them to be recognized by the World Federation of Medical
So you're saying
Education.
ECFMG added that requirement or the state licensing boards?
The ECFMG added that requirement for you to start to be able to do the test. They have to approve your school.
Okay, well, this is as much an information session for us, honestly, as it is for you. So these are the kinds of things that, as a community, we can bring to the process that's going to happen over the next year. We had not heard this previously, so it's something we can definitely all bring to the board as they're starting the process.
And
Okay.
I would also add that the reason we said or other credentialing service approved by the board was to allow for that very possibility, right? We wanted to make sure we gave the board the authority to find another credentialing agency.
Thank you.
Thank you, Jose.
Thank you, Jose. Next up, I'm gonna call on, and I'm sorry if I mispronounce your name, Iduranian.
Thank you. Good evening. Please, what I wanted to find out is at the end of that 3 years, the licensing that you then acquire, would that be recognized by the medical specialty boards in the US? Is there a plan to integrate this pathway with the specialty boards who at the moment only recognized American residencies?
Correct. So keep in mind, the pathway is not a replacement for residency. It's a completely different process to recognize the skills and training you already have. We do recognize that the specialty boards are an issue. We do not conceive that completing the pathway licensure process and practice would then make you eligible for the specialty boards. What we're honestly more concerned about and will be working on is making sure that employers not the healthcare facilities for the license, for the special licenses that we've talked about, but for employers generally looking to hire physicians will not be biased against people who weren't allowed to sit for the specialty boards. I think it's a bigger challenge for us to try to get all the specialty boards to say who can and cannot sit. So what we want to do is, rather than taking that on, we want to cut through it and make it possible for you to be hired even without specialty board status. Does that make sense?
Yes, it does. Thank you.
And,
Okay.
and I would add that now that there are 10 states and other states planning to file in the upcoming legislative session, similar legislation, there's going to be pressure on the specialty boards to open up that process to people who haven't had a US residency.
Okay. Thank you.
All right, next I'm going to jump to a question I see in the chat. And just, I do want to acknowledge, I see everyone's hand raised. I'm going in order, so if I haven't gotten around to it, if it takes a minute, I will call you eventually, but I'm going to go to the chat real quick. My question here is, do you have an idea of what might be the cutoff intake numbers for those who qualify, or if the Mass Board has the discretion to decide based on the demand?
Are we talking about the number of people who can apply? Is that, Blaise, what you're talking about? If it is, no, we have no idea. And I think it's just like, I myself would conceive of it like licensure now. There's no specific limit on it, but there is a limit on how many healthcare facilities are looking to hire physicians. It's a pretty big number, but I don't have a number in mind. And I don't think the board will be looking necessarily. My impression would be the board would not be looking to have a cutoff. It's going to be the healthcare facilities who are going to be controlling the number they're looking to hire.
All right, thank you. And next up, I'm going to go back to the people who have their hand raised here. So, MIRA, go ahead and ask your question.
Hi, congratulations and thank you for all your efforts. I have a two questions. First question is like, what's the actual definition by mean ITP, like internationally trained physician? Because I am from India, and from India, if you study for 5.5 years in the med school, you are also considered as a physician. And if you do the 3 years after 5.5 years of med school, you also considered as a physician, but with the MD degree. So if I did my 5.5 years with the bachelor in medicine, bachelor in surgery, known as MBBS, I would be eligible for this, or I have to do in my home country residency post 5.5 years, 3 years to be eligible for this. And my second question is this only for the permanent resident or the citizens of the United States, or it will be all of them will be eligible?
I'm going to answer your second question first, Nile. This law and the process is agnostic when it comes to immigration status. It has nothing to do with it. If you're eligible to work, then the healthcare facility can hire you. But the law itself and your ability to get licensed has nothing to do with immigration status itself. The first part of your question, I don't have universal knowledge of all practice and training systems around the world, but from what you're describing, the key is, were you licensed or otherwise approved for independent practice in India? If that was the case, then you are eligible to apply under this law. If not, then you wouldn't be.
Assuming that you have practiced independently for a year.
Right.
At least a year.
Okay, thank you.
Sure.
All right, next up, Tarbia, go ahead and you can ask your question next.
Oh, hi, good evening. So Mike, first of all, I would like to appreciate what you guys have done. This is amazing. Because I think this is mostly catering to people who have just completed their residencies back home, have just become they're young specialists. I was certified in my country as a surgeon, and I'm ECFMG certified, and I'm currently facing this exact same issue. Like I have all the certification, I have ECFMG certification, I was a consultant back home, but here I can't like do anything. So this, I think this, what you guys did for Massachusetts, it's amazing. I'm currently residing in Massachusetts. So, I mean, this means a lot. And my question is, would these programs be, I actually have two questions. Would these programs be sponsoring visas for the candidates? And secondly, where would we be able to find a list of the hospitals or the facilities that are participating in this program?
So, as I said before, the process we're discussing and we've outlined is agnostic, has nothing to do with immigration status. So no one will be, there won't be a sponsorship, a visa sponsorship program through it. If a healthcare facility, if an employer themselves wishes to sponsor someone, that's fine. There's no requirement for that, and there's no process for that in the law. It's just like any other person applying for a job who might need a visa. The second part, remind me of the second part again.
Second part was about how do people find out what the list of participating facilities is? And I guess the answer is, and correct me if I'm wrong, Rob, but well, we don't think, I think the best way to find out about participating facilities will be what? Because we're not expecting the board to issue a list of participating facilities.
Here's what I recommend.
Yeah.
So there's no list right now, Tarvia, so it doesn't exist. And once the system has been put in place, I would recommend two things. You could just approach any healthcare facility that is looking to hire someone in general or where you want to work and ask them if they're willing to partner with you in the process of this this program. So there probably won't be a list. No one's going to be certified to say they can and cannot participate. They will apply to host someone, to mentor someone. So it could be any healthcare facility, but they would have to be approved as they apply by the Board of Registration in Medicine. Does that make sense? So there's, yes.
And they would have to be serving an underserved population or region of the state.
Right.
So that's why, probably, we're thinking about federally qualified healthcare centers and community health centers would be the best candidates, I think, for that to approach.
Okay, so like there won't be like, or a list of programs anywhere on a website that we know are participating or, all right, okay. Thank you.
But I will say some healthcare facilities may put on their websites, we would like to participate, or we plan to participate in this program, certainly. But I would recommend, once the system exists, contact healthcare facilities where you would like to work and ask them if they would consider participating in the program.
Yeah, just one more question before I go. Is there any specific page that we can follow for updates as to when we can start applying?
We're going to send that out at the end. We'll send a link to everyone about how they can follow for updates.
Thank you.
Thank you.
Thank you. I'm going to jump back in the chat for a second because I'm seeing a lot of very similar questions about people who have been medical doctors in their home countries and now are licensed registered nurses here in Massachusetts. Are there any advantages about being in this position or any shortcuts to this position?
I would say the advantage is the healthcare landscape. That's probably the most important. But other than that, no, it doesn't on paper get you any advantage. I would say, as someone who hires physicians, if I saw that someone had worked here as a nurse, I would certainly be interested because I know they know how healthcare practice works here. But again, on paper and as it pertains to the law and getting a license, no, there's no difference.
Thank you. And I'm going to go back to people with their hands raised. Ogba, you can go ahead and ask your question next.
Thank you so much for everything. I really appreciate the updates. I'm an international physician. and I've been looking for this opportunity. The only question I'm asking now, or just I would like to be having an update on how we can be able to follow up if finally everything is brought out, so that we'll know how to apply. And then we will need, if it is possible also, if we can give you our contacts, so that for easy updates and then follow up. Thank you.
So it's like you were a plant, because that's exactly what we want to say at the end. Everyone who registered will receive a link to a newsletter to follow updates from African Bridge Network and MIRA Coalition about the Physician Pathway Act, and as the regulations and policies are developed. So just by being here, you will get updates, or you will get invited to receive updates.
And the name of that publication is Physician Pathway News, and it's very specific to tracking this law, previously
Yeah.
this bill.
I have one question. May I ask?
Hold on. Who is speaking right now?
Himanshu?
We're waiting our turns, all of us here.
Yeah.
Yeah, so go ahead and raise your hand through Zoom, and I'm going to get around to you. I'm just going in order for who raised their hand first. Okay.
Okay.
Thank you. I respect that. Next up, Christina, go ahead and ask your question. Christina?
Yes, hi, I was just muted, sorry. Hi, Amy, this is Christina
Hey, I thought
Konechny.
it was
Yes,
you.
yes, that's me. So I have a question. How has it worked in other states in terms of the implementation and afterwards, let's say after 1 year, 2 years, like working in primary care, because I'm a specialist in primary care and I currently work for Tufts Medicine as a nurse. So if I am to approach them and all of it, and let's say it works, how we will be seen after that? Let's say for whatever reason we don't continue the employment with them, will be primary care physicians? I know we're not certified with the specialty board. Just, do you have any information about that from other states and
I would
some
just say
guidelines?
briefly, other states are not very far ahead of us. No one
Oh,
has
okay.
really seen any laws implemented across the country. They all recently passed, and they're in very much the same situation as we are in Massachusetts, just starting to get things going.
I see. And what about when it comes to what healthcare facilities and settings are part of this in other states? Do we expect that local satellite healthcare facilities in terms of doctors' offices that are part of larger healthcare centers will be applying?
Well, again, it's up to them. So we
Right.
can't.
Do
we
you know
can't,
from experience or like from other
there's no,
states?
to be
No,
honest, there's no experience in
no
other states.
experience, no
And I
experience.
would say the Massachusetts law is specific.
Right.
So it's going to be up to Borum to say
Right.
who can
Because
participate.
I am ready. I'm ready to go tomorrow to Tufts Medicine and start talking with the providers, because they are hiring, they're looking for NPs and providers. And I've been in the healthcare field for 6 years. I know the layout of the land. I've worked
Yeah,
in,
great.
as a nurse, because I am a nurse too. So
I think the best thing you could do if you're looking to stay there is make sure they're aware of the law and tell
right,
them
I'm
as
going
it
to.
tell them
Yes.
as it progresses, you want to apply.
Right,
So
right,
they'll be aware.
yes. Because I take it that Tufts Medical Center, as one of the largest here in the area, would take part of it, because they have also community centers outside of Boston.
Mhm.
But okay, I was just wondering. Well, thank you, I appreciate it.
Sure, thank you.
Thank you. I'm gonna take a question from the chat really quick. And I apologize if I've missed any questions in the chat. There's a lot coming through, so I'm trying to focus on the ones we haven't really touched on yet. So this question here is, if you previously had a specialty from your home country, is that specialty still valid? And do you have to remain in the same specialty?
I think that's a little bit outside the scope of what we're trying to talk about tonight. If you're talking about within the physician pathway law, I would say there's no requirement that says you have to remain within your own specialty, but you might need to retrain. Again, it's up to a healthcare facility. If you trained as a urologist, they probably won't want to hire you as a psychiatrist, right? So that's why much of this is left to the healthcare facilities. It's not about the licensing board.
Next up, Apriani, go ahead and ask your question.
Hi, I'm Apriani. First of all, thank you so much for all your effort. I've been longing to hear this news for a long time. So this is like a early Christmas present for me. Thank you so much. So my question is more of a clarifying question regarding the no look back period. I know you mentioned a little bit. So is there any restriction as far as how far an ITP is from their last clinical practice or graduation? Because I know that a year of graduation is extremely important for applying to residency. And the second question, which is also a clarifying question, is does an ITP have to have a currently active license from their home country when they apply for PPA? And how about those who had once a license, but it has expired by the time they apply? Thank you.
As
You
you
can
can
answer the
probably
last
tell,
question.
yeah, go ahead.
So
You're shaking your head, probably answered it for most people.
yeah, so in the law, we were very clear that they have to have been licensed or otherwise authorized to practice in the past and have practiced for at least 1 year independently. So no, they don't have to have current license. Go ahead,
Thank
you
you
can
for
answer the second part, Ram.
Sure. So part of our goal was to get away from the biases that exist in residency applications, such as we all know there's sort of an unofficial look back of about 3 years, no more than 5 years, even though it doesn't exist on paper anywhere. So again, we're leaving this to the healthcare facility employers. Anyone can apply. There's no specific designation of a look back period for the license. But I'll just be honest, I think if you haven't practiced in 25 years, probably a healthcare facility may not deem you a good candidate. And I use 25 years, I'm trying to be extreme. But other than that, it's really between you and the employer, how they feel about it. So there's no specific number.
And it also depends on what you've been doing, right? So, as Christina, who spoke earlier, she's a nurse and she's working in a healthcare facility now, so obviously a facility that's looking to hire is going to be considering what you've been doing in the interim period.
Thank you.
And that's why we always encourage people, stay involved in healthcare somehow, whatever it is. If it's being a nurse, if it's doing healthcare research, somehow stay connected to healthcare. It's always going to help you.
Thank you
And-
for
Yeah. And I would also say African Bridge Network is one of those wonderful organizations that helps people find alternate employment, people in the healthcare field to find alternate employment in the healthcare field. So that's something to pay attention to as well.
Can I have one last question? And thank you so much for clarifying. I know that there's a lot of an unknown area as far as now, but what would be the evidence that we have to submit in terms of proof of having practice in our home country for somebody who, for example, no longer have an active license?
I'd say that's to be determined, but very similar to documentation you might have to provide to an organization like ECFMG, something like that. Definitely would have to show a copy of a previously provided license or authorization to practice. And I don't know yet how you would document that you did practice, that you did indeed practice. I think that's something we have to figure out. And it's an excellent question. And again, your question is going to help inform the process of how the regulations are developed. So it's a great question. Thank you.
Thank you.
Thank you. Next up, I want to call on Saida. Go ahead and ask your question, please.
Oh, hi, good evening. Thanks for organizing this. My question was, I was wondering because there's at least a year to the expected application start time. And we all know that all the ITPs are desperate to get to practice because it's something they love to do. So that being said, we know that other people from other states will be flocking Massachusetts, at least so that they can be Massachusetts residents within 1 year at least. So will the application process be any helpful for those who've been in Massachusetts for at least a couple of years and, working in some healthcare and, facilities, research, clinical
Just
areas?
it's just like anyone applying for any job. There's no residency requirement that you live in Massachusetts before you apply for any other job. So the same is here. And in fact, you don't have to be a Massachusetts resident to work as a physician in Massachusetts. Many people from Maine, New Hampshire, Vermont, New York, Connecticut, Rhode Island, all the surrounding states cross the border to work in the state. And everyone under this license could do the same. So I guess that's a positive for your question. That's also a negative. So there's no advantage to having lived here. I would say the true advantage would be the state. You will know healthcare facilities better. You will have the opportunity to get to know people who might be hiring. You will know how things work in the state. But other than that, uh, there's no advantage provided to someone who's been living here longer.
Thank you. I think before there was something like that, a year or two being a resident in Massachusetts. There was something like that during one meeting before this, I remember. That's why I asked.
I'm not aware of any provision like that because, as I said, you can be a resident of New Hampshire and get a Massachusetts license if you're going to be working here. So I don't think so, but we
I
can look
think
into it.
I think the reference might have come from, the fact that when we've talked about this bill, we've often said, that the physicians that will benefit from this are already here. That we have a lot of state residents here in Massachusetts who fully expected, on living here that they would be able to re-enter their profession, and they haven't been able to. So that was sort of the initial thrust of the legislation, if you will. And the added benefit is, of course, we do need a lot of physicians, so it's open to physicians from other states as well, obviously. So there's no residency requirement again, but that's probably where that may have been what you heard.
Thank you. Next up, I'm going to pass over to Rere. You can go ahead and ask your question, please. Rere Peterson, if you're ready to ask your question, you can go ahead and unmute. All right, I'm going to go to the next person for now, though, until they come back. Germaine, go ahead and ask your question.
Yes, hi, my name is German. Thank you so much for this important news, and I'm happy this session is like interactive, like able to ask questions. My question is, if I am international medical graduate, I am here in Massachusetts, and I finish 1 year preliminary residency, but in different state. Can I apply once the application is ready to the second step, which is the 2 year restricted license, and bypass the renewable or like the 1 year limited license, the initial step? So can I start from the second step? Because I did already the first step here in the US.
The thing is, German, were you licensed or authorized to practice in another country?
Yes, I was a pediatrician for like 5 years.
As far as I understand it, and Amy can weigh in, I don't think you could bypass the steps. You could do it for as little as 1 year, but I don't think there's any way, as it's written, to bypass it. You could apply on your own, as you have, not through this process, but I don't think there's no provision for bypassing the steps. It's really, in your case, you were a pediatrician licensed or authorized to practice in another country, that's what qualifies you. The 1 year of residency in the US doesn't pertain here. And I know it's very hard to get that kind of position, but we specifically wrote it that way because we wanted people not to be forced into trying to apply for the limited number of residency slots. So I congratulate you on getting that position. For this program, it doesn't actually benefit you, except when you apply, if you do apply to a healthcare facility, they'll be thrilled that you have that experience.
Just 1 year, I mean, in Massachusetts or maybe in other states?
It doesn't matter. It doesn't matter. And anyone with that kind of experience, I can tell you, will be more employers eligible, possible employers would be more interested in you just because of your experience. Doesn't depend on the state.
Like more clarification, I'm sorry. So any place in Massachusetts can accept only 1 year US residency or like a preliminary year? It's like
No, there's no mechanism as far as I know for the Board of Registration to provide a license based on 1 year preliminary residency. So you would have to enter the program the way everyone else is going to, applying based on not your prelim year in the US, but your pediatric practice in the other country.
Before. Okay.
Yeah, yeah. Which we applaud you for. It's great.
Yes, thank you so much.
Sure.
Thank you. I'm gonna ask one more question on the chat here that I'll just repeat it, so sorry for missing it. Does the work need to be continuous? So like that year time, does it need to be continuous, or if there's like a reason, like maternity leave or something along those lines, would that impact the time period that's required?
I would say, and I don't think this has been addressed specifically, but it would be 1 year of practice. So if you took 6 months off for parental leave, let's say, similar to, I hate to say it, but similar to residency programs or other training programs, you would have to continue and complete the full amount of time designated by the program. Of course, based on state law, you're allowed to take off time for parental leave, but you would have to complete the full year within the program to be eligible to move on to the next step.
And I think if I understand the question, I think part of the question was, well, the question was, does it have to be continuous? And there's no requirement in the law that it has to be continuous. Just has to add up to a year.
Perfect. There you go. Next up, I'm going to call on Amir. You can go ahead and unmute and ask a question.
Hello, everyone. Thank you so much for organizing this event. Been waiting a long time for it. So I have a couple of questions. Like one question, I think German asked the question already, but I have similar situation. But I did a year geriatric fellowship here in Massachusetts. I had the limited license for a year. So I think like from your answer, maybe it's not going to apply. So I need to go through the process from the beginning.
But again, having trained in geriatrics, as an employer, I can tell you they're going to be very interested in you. So I don't want you to think it was a waste, even for this program. It's definitely going to be to your benefit.
Okay, good. So I have another question about to get the full license. Does the rule of like having all the 3 steps within 7 years still apply for this pathway, or same like?
No, it's not that 7-year requirement is not relevant here, but here it's a 6-year process. So again, we're not saying about whether it's continuous or not, but you could have up to 2 years with the first license, right? And then you could have, that's the limited license. And then you could have up to 4 years with the restricted license. Now, remember, for those of you who have done postgraduate training, residency in the US, to whatever degree, when we say limited license and restricted license, it doesn't mean what you're used to it meaning. Okay, so the limited license is not about what you can do, it's about where you can do it. And the restricted license, similarly, is not about the scope of your practice, but it's about where you can do it and who you serve, meaning that we want it to be in an area of greatest need in the state. So just to recap, 6 years is the most, is the longest someone would participate in this program, but you could participate for as little as 3 years, and with that, you would have successfully completed the program. It's really up to the person applying for the license, how long they want to stay in, and the healthcare facility that's employing them to say, you know what, we think you need another year of limited license to really be comfortable, and you would come to an agreement with them.
I want to make sure that you got my question clear. Right now, like to get the full license, there's a law that said it's a time period between step one or the first step you passed and the third step need to be like within 7 years. Does this still apply for this pathway?
That's going to be up to the Board of Registration in Medicine. But so there is nothing laid out in the law that addresses this specifically. Again, they're going to defer to the Board of Registration. And again, this is a great question to come up, and it will be, and we can all make sure that it's brought up during the process of developing regulations. My impression would be, I don't actually know, but very likely it could be that the same timeline is implemented, but I don't know, and there's nothing on paper yet.
So other questions, sorry, I took so long. How about like Medicaid and Medicare? What is their perspective? Like, are they going like with the billings? Because I know some states they will ask like for your licensed physician if they didn't like finish 3 years like
right
ACGME accredited residency, they're not gonna like pay them or restrictions the billing. It's gonna be the same story here, or
it's an excellent question, and that's why during this year, there'll be a lot of work done with the state Medicaid program as well as with private insurers to get them on board to be able to bill. And that's one of the things we need to work out in regulation. But it's an excellent point, and you're right. If we did nothing, people would not be able to bill, and therefore people wouldn't get hired. So that's part of the work of the coming year, is to make sure that those processes are in place so that employers can bill for your work.
okay, thank you.
I think yes. We have time for a couple more questions, probably 2 or 3. So I'm gonna be quick here. YB, do you want to unmute and ask your question?
Yes, please. It's really a great feat, and I want to say thank you and congratulations to everyone for this great feat. I have just a few questions. First of all, I wanted to ask that after someone goes through the process, are they deemed a specialist, or are they what then are they recognized as after the going through the 3-year mentorship?
So I guess YB, my question is, what do you mean by specialist? Because
So
there's
let's
no...
say, sorry for
no, go ahead.
So let's say you are mentored in psychiatry or internal medicine or pediatrics. After you've finished the whole process, like step 1, step 2, and then you apply for this pathway, and you are mentored under a psychiatrist or under a pediatrician or an internist, would you be considered a specialist, like in internal medicine or pediatrics afterwards?
I guess the question I would ask is, what was your specialization in your country of training?
So for my country, you are given a permanent license to practice after 2 years. And then after that, you enter residency from there. So usually you don't really have a specialty. Mm-hmm. So it's like you're now starting a specialty or entering into residency, so to speak. Yeah.
So I think officially, I don't know the answer. And I don't know, for instance, what the board would put down as your specialty on your license. So again, it's an important question for us because we do know there are a number of countries where the system is exactly as you outlined. People finish their training, they can work for a while, and then they develop a specialization after that. So in the past, there was a sort of general physician category a long time ago in the US. It doesn't really exist now, but this again is a very important point that we're going to have to make sure the board addresses.
Okay. All right. Thank you.
Thank you for the question.
Thank you, sir.
All right, next up, I'm gonna have Himanshu. Go ahead and ask your question. Himanshu.
Yeah, hold on. Hello. Yeah, thank you for providing me opportunity. Actually, I wanted to ask you, and just like one of the guy already asked the questions, like those who have done the subspecialty training. So I also completed my residency and worked as attending in few years in India, and completed all the USMLE. And this year I will complete 2 years of my subspecialty training in United States. So am I eligible directly to get the restricted or the restricted license? Or still I have to go
As
through
far
a...
as we know, well, not based on your specialty training in the US. It would be the process would be based on your training and licensure and authorization to practice in India. So on that basis, you could apply, but I don't think you'd be able to jump over the first license.
Okay, because like few of the organizations were looking for my subspecialty and they were hiring me, but as I cannot give my board without residency, so that was the main hurdle.
Right. To be honest, this was not really a possibility that a lot of us considered beforehand, because the barrier for most people is the residency. You're one of the lucky few who've done any specialty training in the US. So I think from the law's perspective, the general approach is binary. Either you practiced and had a specialization in another country, or you've completed training in the US and therefore are eligible for the usual pathway to licensure, not the special new pathway. So I don't think there's really a way to do something as a hybrid. We'll definitely look at it, because clearly you're not the first person who brought it up. But I would just say my impression right now would be that you would not be able to apply for the second license based on your work in the US.
Okay. So is there any chance like in the future, like they also consider that those who are already trained, like instead of directly those who are coming from outside United States, those who don't have any United States exposure, we are giving the license, but those already trained and here, so if they do some sort of eligibility for the board certification, so I think there will be a huge healthcare manpower.
It's true, but if you were eligible for the board right now, you wouldn't need this program, right? If you were
Yeah.
eligible for the specialty boards, you could take them and then directly apply for a standard license. So you wouldn't need this at all.
Good.
Yeah.
Yeah, but without residency is not eligible, I think so.
Right. And again, that's why we created the program,
Okay.
the law, so that the main factor it bypasses or allows people not to have to do is another residency. Again, you're very fortunate, as a few other people on the call were, that you've done some further training in the US. The law does not specifically address that category. We will definitely be looking at it with the Board of Registration, but I'm just giving you my expectation would be, especially in the first year when this program launches, that it would not be possible to bypass the first license.
Okay. So sorry, I missed the initial part. So may I know like what is the provision like? Is there like one has to work under physician and the residency program for the 2 years?
Recommend, Himanshu, if you missed the first part, the recording will be available. We'll send out slides, but rather than
Okay.
repeat it
Thank you.
here.
Thank you. I
Sure.
highly appreciate it. Thank you. Thank you for your opportunity. Yes. Have a nice day.
And the short answer is, for the first year limited license, It's not, you're not working under the supervision of a licensed physician. You're working independently in a facility approved by the board that's chosen because it serves people who are most in need.
Right.
And that's where the assessment and evaluation comes in, but it's not the same thing as a residency, and you're not supervised. You don't have a supervising physician, right, Rob?
Correct. Supervision is not what the law addresses, because if you have already been trained and authorized and practiced, you don't need supervision. You have all the training you need. This law allows you to be mentored so that you can learn to practice in the environment in Massachusetts, but you don't need any training at all because you've already got that.
Good, thank you. So Amy and Rob, I know we mentioned 7:15. Do we want to take any more questions?
I'm glad to keep going.
Right. Great.
I am as well.
Okay. So I'm gonna hand it over to Vitali right now. You can go ahead and ask your question. I think you're muted.
Yeah, I'm that was. Thank you very much. Yeah. I come in the US, it's around 7 years, and I was a medical surgeon in my country. And my imagination for US system, medical system was very wrong. Because it's in our country, if you finish medical school, you have license for all country first. Here, it's every state, it's have every state have his own license. And my question is, doesn't matter, but my question is, if I finish in the surgeon, I can to apply for primary care physician. And the second question is, I need to find health provider who can to give me this opportunity to apply this program, because if I can to find health provider who give me this opportunity, I can to apply. I understand that's correct or not?
So I would say, Vitali, the way it works is it's going to be up to the healthcare facility if they want to hire you. We applaud your training in surgery. You know, some healthcare facility may say, we'd be glad to hire you. We think you know enough. Others would say, we want you to have a primary care training. So it's, again, the Board of Medicine doesn't weigh in on this part. It's whether or not a healthcare facility would hire you. And yeah, that's really the primary thing.
Yeah. And the second question, it's like you mentioned there, you need to have USMLA one step and second step for applying program. And
So again,
for a full license, you need to have third step of the USMLA. But if you have 3 steps of USMLA, you can to go to take your residency.
you can apply for residency. That's
No,
fine.
it's the general. It's like you make some opportunity there, but not big opportunity, you know. It's like you can to take residency, but you need to have everything what was before, you know. It's like same, you know. It's like if true speaking, it is like same. No easy way or something like that, or depend of the health provider. If he need to urgently somebody a primary care provider, and he have no, I don't know, NIP, but he wants to be MD somebody. You
So
understand
again,
my question? It's like
as Carmelo asked before and pointed out, this does not solve all the barriers and hardships that we know all of you face in trying to gain licensure and practice in the US. So we had to strike a balance. This law had to strike a balance. We know that if we said in a proposed bill, let's get rid of the USMLE requirement, the lawmakers would not pass it. because they're going to ask the Board of Medicine, they're going to ask all these people, is this a good idea? And they would say no. So maybe someday there'll be something more inclusive. And I understand the frustration that this still leaves barriers in place for folks. But again, it was designed so that residency would not be the barrier. Yeah.
And I guess I would add, like, the problem with residency is you can't do it on your own. You know, you have to be accepted, and you're competing with people who just graduated from medical school. Whereas the licensing exam, many of you have already taken them. You know, it is possible. I'm not saying it's easy. I'm not saying that it's not an incredible expense also.
But law make it to a little bit easy to take license. No easy to make more improve in the medicine or something like that. You make law for easy to healthcare unit applying you. You know, it's like provider can to take hire you easier. You know, no from my experience make more experience or something like that. It's same way.
Yeah, I understand. It like I said, it doesn't.
This is more opportunity for healthcare providers, not for us, for doctors from other countries.
Like I said, it doesn't take away all the barriers. We're hoping that for many people, it reduces the biggest one, but I definitely hear your frustration.
Rob, Emmanuel, can I chime in a little bit? So, Emmanuel from African Bridge Network, we've worked with this population for a while. We foresee providing some support for those who want to pursue this opportunity. So there is more to come. We are very at the early stages of the law now. We have to go through the processes. So I would say, hold your peace and let us work through the process. Definitely, there will be some support for anyone who wants to at least give this law a chance or try to take advantage of it. Okay.
Yes,
Thanks,
thank you,
Emmanuel.
Emmanuel, for the positivity. So I'm gonna move on to the next question here. I see, Jose, you have your hand raised up again, so I'm gonna pass it over to you.
Thank you. Yes, I do have another question. So I graduated and I got my unrestricted license in Mexico, but I didn't practice for that year. As soon as I graduated, I had other circumstances and I had to come to the States to start raising funds to help out my family. So I didn't get the opportunity to actually practice. But if I'm able to get an employer here, am I still able to apply for the program?
Based on what you're saying, I don't think you'd meet the requirement because you didn't practice. The law says you have to have been in practice for at least 1 year. So my impression, and I don't want to give you a final verdict without someone actually looking at your case, but my impression would be no.
Okay, because my curriculum is a little bit different. I did an intern year and a social service year. So on my intern year, after that, I did like birth deliveries was by every day. And then I would scrub into multiple surgeries. I did ER, I did internal medicine, pediatrics, and those actually were my patients for a full year. And then on my social service, like I was a different department and I was also seeing patients.
I'm a
What I
little
mean
bit
is
familiar with the Mexican system, and I would definitely say yours is a good case to bring forward because you may be able to argue appropriately that you meet the definition. So that's why I don't want to give any final word at all on whether or not you'd be eligible. You'd have to put forward an application.
okay, thank you.
Thank you, Rob. I'm gonna pass it to the next person here with their hand raised. Aluchi, go ahead and ask your question, please.
Hi, thank you so much for the program. I have a question, and my question is a little bit different from what others have been asking, and it was prompted by a comment made. And the comment was that ABN, the African Bridge Network, has been helping people to get job opportunities in research, in the research space. So I'm just asking, how can one leverage on that?
So if you're looking for the opportunities with African Bridge Network, I would recommend, we'll put their website up, and I would contact them directly. A great resource, so I would contact them.
Yeah, reach out to us later on.
Okay, thank you.
Questions. Do you have any
Okay.
about?
Yeah, yeah. So would you put it in the chat or would you send it? Okay, I got it already. Thank you.
All right, thank you. Next person here. Let's see. Sarepta, go ahead and ask your question, please. Sarepta, oh, there you are. Okay.
Hello, my name is.
Hello.
Oh. Hello.
I'm sorry, Jack.
Aluchi, if you could
can
go
show-
back to mute.
Can you hear me?
Yes, go ahead.
Okay. I have graduated from medical school in 80. And of course, I've worked about 2 years after my graduation in licenses. My only concern is that my school don't have any accreditation for me to be able to pass the steps of the USMLE. And then, which is one of the qualification, like the first and second steps. So as we are looking for a chance to serve
Sorry,
here.
Regina, could you mute yourself? I think we hear the baby who sounds very cute. Thanks,
Sorry,
Repta. Go ahead.
Okay. So I wanted to know, as you said that you are going to look for some other accreditation, I wanted to know, how could we be able to know about those accreditation plan, if there's gonna be an exam test to pass and whatever the thing is, how can we be able to get the steps of the USMLE?
So there won't be any separate exam. So if it's a question of accreditation from the school or on the part of the school, that will be something for the Board of Registration to look into. Again, we didn't say that the school has to be accredited, it has to be recognized by the WHO. So we recognize that in a lot of areas that are under duress, in conflict, like Haiti, Syria, Yemen, other places, the school just has to be recognized. We're not looking necessarily for accreditation because given these circumstances, it may not be possible. But there will not be any clinical exam for you to pass. Again, only based on what I'm hearing, Srepta, you would be a good candidate having practiced after your training for a few years. So I think you would definitely be someone who should put forward an application.
I have another question. And as this, you said that it's gonna be up to 6 years to be unlimited licenses here. And then let's say we are served for 6 years as a provider in primary care, and after that we up to go to the residency. Is that gonna be a plus for us, or it just gonna be the same process?
Again, I would say on paper, you would be the same as any other candidate applying for a residency. I will say personally, as someone who's interviewed people for residency, if you've been in practice for 6 years, I'm going to be pretty impressed. So again, some people might see it as a negative. I would see it as a positive. But I can't speak for any residency program that you might apply to in 6 years, but you could also do it after 3 years.
Okay. Thank you. And just a reminder, it doesn't matter for the participation to be actual Massachusetts resident, right? We can live in different state and we'll still be eligible to
You
apply
can live
for it.
any place you want. So all the time, people apply for Massachusetts license, living in other states, either because they're already working here or because they plan to work here. There's absolutely no requirement to be a resident of the state of Massachusetts in order to apply.
Thank you so much. I
Sure.
appreciate your time.
Thank you.
All right, thank you. Next up, I'm gonna try to go back to Ray. I think I tried to call on you earlier. Are you back? Ray. Okay. The next person.
I would
Rose.
just say, Frere, if you're able to, if you can't unmute, maybe type your question.
Yeah, go ahead if that's the case. But for now, I'm gonna go on to Rose Nadine. Go ahead and ask your question, please.
Hi. Okay. Hi. I appreciate this opportunity and your work. And my question is, if a candidate want to apply for this program, if immerse take USMLE step 1, step 2, or step 3, or if the person has only the license to practice, he can apply to this program. And after my second question, if the person have this program, it will be general practitioner, or the person we can take the residency for like pediatric or another specialty. Thank you.
So I'll just say, Rose Nadine, that you would have to meet all the requirements to be able to apply for the license. So it wouldn't be just the USMLE steps or just a previous authorization or license to practice. You would have to meet them all. In terms of specialization, in your practice under this specific licensure structure, it would be based on your previous experience and again, what the employer agrees to. It's a good question. I don't know how the board will manage designating your specialty. I don't know. And it's good that you and others have brought this up because we'll be looking for the board to answer this. In terms of how it would position you to apply for residency afterwards, I would say it's mostly unrelated. It's sort of like I answered before. Certainly, it's good experience, but there's no specific relationship between doing this program and then applying for residency. We can't speak for residency programs.
Oh, okay. Okay. Okay, thank you.
Thank you.
Thank you. Next up, I'm gonna actually look in the chat and see if we have any questions that we haven't gone over yet. Let me see. Okay, I'm seeing some repeats, so I'm just gonna jump back into the people with their hands raised. McEwen, go ahead and ask your question, please.
Hi. I really appreciate this opportunity. My question is, I'm recently graduated as a medical doctor from Dominican Republic last year, 23. So I came here last year or to United States. I wanna know how I can get the license to work here, or what the requirement to enter in this program too.
So first of all, congratulations on finishing school. That's great.
Thank
Just for time's sake, McQuinn, I don't want to repeat the requirements because we did lay them out earlier, and we will send them to everyone. You'll have access to this slide. If you did not, if you were not licensed in the DR or you didn't practice in the DR, then you wouldn't be eligible under this program.
You say?
So you said you finished medical school, but I didn't
Yes,
hear that
last year.
I didn't hear that you practiced medicine in the DR after medical school, or that you had a license or authorization to practice. So you need both those things in order to qualify under this program.
Okay, so how I can get the license here?
I'm gonna leave that one, Miku, and many of us would be glad to help you answer that, but we're gonna focus tonight on internationally trained physicians, meaning people who already had met the requirements, and you, based on what I'm hearing, you would not meet the requirements for any license in the state of Massachusetts right now.
Okay, okay, thank you.
Sure.
All right, thank you. I'm going to pass it over to Regina. Regina, you all ready to ask your question?
If Regina doesn't come off mute, Maddie, I see Olesia afterwards raised their hand in the chat, so I just want to make sure you see that some
I see.
people apparently are doing that.
Okay, got it. Thank you for bringing that
But
to my
Regina seems to be able to unmute.
attention.
Go ahead, Regina.
Regina, also, if you're unable to unmute, you can also ask your question in the chat. I see you kind of going on and off a little bit.
Can you hear me?
Yes.
Oh, okay. Thank you. Okay, so thank you for your patience. And then, yeah, I don't wanna you to the answer, the same the question, but I think maybe you already mentioned, but my question is, could you narrow the potential health facilities in terms of the level of a hospital and any county where I can apply or at least contact? There are hundreds of hospitals in the state, right? So maybe just a little bit practical advice I can maybe contact health the facilities to maybe potentially will be involved to this program.
So as we said, we don't have that because the list doesn't exist yet. And I would say, if you know of a healthcare facility that operates in an area that's underserved in terms of the number of physicians or in terms of the need of the community, that's a very likely a facility that will want and meet the requirements. But we don't have a list right now. I apologize.
Okay, thank you for the answering. And the second question is, I'm sorry, I'm a little bit confused. Is underserved health? Is it refugee health or just the generally underserved, medically underserved area?
there's a specific definition of what we're talking about, and we'll have links, hopefully, from here. If not, you can look, I think, at the MIRA website and find some links, or we'll create them if we can. But there's specific federal and state designations of the areas that we're talking about that need additional services. So it's not specific to refugee health. That's a separate program in the state. But we can try to point out, if you look up on the state, if you just Google it, you can see underserved areas, and they're state designated. Again, we'll try to get a link, and I say that not being the technical person, try to get a link somewhere so that you can see that.
Thank you so much for your answer.
Sure.
Jeff, if he's still here, could probably answer that question and supply the link. Jeff Gross, are you still with us?
Yes, I am.
Ah, there you are. Am I right?
Yeah, I will follow up with you, Amy, on this and share a link.
Thank you. I thought you might be able to just drop it right in the chat.
All right, thank you guys. I do just want to do a time check for Amy and Rob, see how we're doing.
I see more questions, so I'm okay to stay for a bit.
All right.
I'm just going to say that the list keeps growing as you keep answering questions, Rob. Like, there's always 6 or 7 people. So what I want to encourage people to do is to ask just one question. Just pick one, don't give two, pick the one that's more important, and also not to ask a question that's been answered. Like, I think general questions are better than my situation is this questions. Like we're trying to answer questions about the law, who's eligible, who's not, and with the limited information that we have. And so rather than sort of devising individual solutions for each person, I think our time would be better served. I mean, it's interesting and it probably helps other people in the same situation, but for time's sake, some of us want to have dinner.
Right. For addressing that, Amy. So just keep in mind that she said that, so no super specific questions, and let's just try to keep it sort of short and sweet. I am going to address Alessia. Sorry, you had your hand raised in the chat. Do you want to go ahead and ask your question?
Hi, yes, can you hear me, guys?
Yes.
Okay, perfect. Very quick question, I promise. And thank you very much for the tremendous work you guys have done. So quick question. I live in Massachusetts, work in Massachusetts, and I love Massachusetts. But let's say I go through the program and graduate, and I will need to go to California, for example. And I'm already licensed in Massachusetts, right? So will I be able to work in California? Will I be able to get a license in California based on the license in Massachusetts? Thank you.
So I'm going to answer that with a general response, Alessia. If you have a full Massachusetts license, just like anyone else, you can petition to California to accept your license and give you one there. I don't know what the status is for all reciprocity situations, but some states will recognize a full license from another state and give you a license on that basis. But I don't know the specifics about California. But I would say once you're have a full license here, you'll be able to do with it just what anyone else would if they got their license in the standard system.
I got you. Perfect. So there will not be a difference between people who went through residency in the United States or people who graduated from the program.
I can't speak to how another state would respond. That's what I want to say clearly. You know, boards of medicine are different in each state. So, you know, California, for instance, could say, oh, no, we don't take anyone for licensure if you haven't had a residency. They could do that.
I see. Okay. I see. Thank you very much. Thank you.
Thank you. Jaspreet, go ahead and ask your question, please.
Yeah, thank you, Amy and Robert, for your wonderful presentation. I have most of the question have been asked, but I just wanted most of people here on this session, they are already meeting the requirements for this program. So I just wanted to request the MIRA and the ABN to come up with a list of underserved area or healthcare facilities, so we can, start applying.
Sure. As we said, as I said, I'm going to ask my colleagues to try to work and get that up on the website, and
Yeah,
we'll
that
work
will
on
be
that.
really helpful for people who are already been waiting to allay the anxiety of one more year to keep on waiting to implement this program. So, well, that was my question. Well, thank you so much for these
Thank you,
efforts.
Jaspreet.
Thank you. Next up, Niove. Niove, I think, I'm sorry if I'm mispronouncing that. Go ahead and ask your question.
Hi, can you hear me okay?
Yes.
Yeah, I'm a medical doctor graduated in the Dominican Republic in 2010. And right after I graduated, I came to the US for a few years. So I did practice 1 year internship before getting my degree as an MD. But I just came back to do another 1 year. It is called pasantía in Spanish, but in English it would be like another internship. But in order for me to get the license in this country. So my question is, can I apply without practicing in my country after I get the license here? Or do I have to practice another year after I get the license?
I don't think we're able to comment on specific cases because it would have to be reviewed. So I can't say I would say if you meet the guidelines that we laid out, then you could. But again, I don't know the system, the DR well enough, and I think you're best served. Hopefully, at some point, there'll be a system for people to ask questions to the board, but it doesn't exist yet. But we're not the board, so I don't want to offer any information.
No problem. Thank you.
Thank you. And as Amy said before, I think specific cases are much harder for us to respond to. So if you have more general questions, that's great.
Hello,
Who is speaking?
Clifford. I got a question, please.
Hold on 1 second. Will you have people raising their hands either in chat or in the
Okay.
thing so we can go in order? So just go ahead and put your question in the chat or raise your hand and we'll get to you soon, okay?
Okay, it's okay.
Thank you so much. Okay, next up, Junior, go ahead and ask your question, please.
Okay, thank you so much. Thank you for this meeting. My question is like, for someone who completed medical school and back like from Haiti, I have the license to practice, I work for the state, and I have so many experience in the US. I've been in the hospitals here doing clerkship and rotation in different states. But I didn't complete like a specialty program. I started my surgery, but I did not complete the surgery. However, I had so many experience like working here in cardiothoracic surgery, orthopedic surgery, spine surgery, and here in Massachusetts, Spokane, and different states. Am I eligible for that program?
I'm just going to say briefly, without reviewing your whole file, Junior, I would think you would be based on what you said, but it's based on your experience in Haiti, not related to your experience in the US. That's my short answer. But so yes.
Thank you.
Except that it's relevant when someone wants to hire someone, right? Whatever their experience in the US is, it's going to
Right.
make them more interested in someone if they've had a lot of experience, right?
Yes.
Yeah.
But I do have experience in Haiti. I've been working as a physician for the state.
Perfect. Thanks, Junior.
All right, thank you. Next up, Natalette, please go ahead and ask your question.
Good evening, everyone. Thank you for this opportunity. My question is, I study medicine in Dominican Republic, and after that, I returned to my native country, Haiti, and I did my specialty in pediatric. Now I'm doing a master in public health. I've been working as pediatrician and research physician in an accredited center in Haiti. So I want to know if I am eligible for this program.
It sounds like you are Netherlands. Again, a specific case would have to be reviewed, but from what you said, it seems like you meet the criteria. So yes.
Okay, thank you.
Sure.
All right, next up, Mahendra, go ahead and ask your question, please.
Hello, thank you for the opportunity. My question is a little bit different than other all. Like after the full unrestricted license, can we apply for fellowship in future, like oncology or GIT or something like that? Like it's similar to USMLE residency, or is little different?
I would say it's very different, Mahendra, and as I said to other folks, I can't speak for a fellowship program about whether we would accept you or not. I don't know. I would hope so, and we would advocate for that, but I don't want you to apply for the program thinking I only want to do this if I can apply to a fellowship later. I think it's a worthy goal, but I just don't know. And I think no one knows at this point.
Thank you.
Sure.
Thank you. Zayad, go ahead and ask your question, please.
Hi, thank you. Good evening, and thank you so much for your hard work. My question is, can I apply to get the license directly, given that I have approximately a decade of obstetrics and gynecology practice in my home country, and I am ECFMG certified, so I've done all the USMLE tests, step 1, step 2, and the CS.
So I guess I would say the same, that for specific cases, we can't fully respond. I would say if you meet the criteria as laid out, then yes. Again, it would be, if you do, then it would be about getting a healthcare facility to want to employ you.
But the next step is to apply to get a license, or is it only the ECFMG that I need?
Again, I can't honestly keep track of everything, but look through the list of the criteria. And if you meet all the criteria for licensure, then you could approach a healthcare facility about employment.
I just want to
Okay.
be sure that he knows that you know that we're talking about, I think, if you're talking about applying for the program, in other words, a limited license, then if you meet the criteria, then you're eligible for the program. But if you're talking about being able to just apply for a full physician license here, this program is going to help you. And yeah, you would have to do a residency here.
Yeah, I'm asking not about the residency, but about applying for a job. Do I need like a license first, or should I contact the health facility?
If you're talking about just applying for a job and sort of outside of this program that we're talking about, you would need a license to be able to work as a physician at any facility.
Right. And to apply to your program, whom should I contact?
Again, as we said earlier, there's no one to contact yet. You might want to look around and have healthcare facilities in mind that you would want to approach once the system is developed and people can actually apply to it. But there's nothing to do right now. Specifically, just make sure that you meet all the eligibility criteria.
Okay, thank you.
Thank you.
Thank you. Norma, go ahead and ask your question, please.
Hi, good evening, Amy and Dr. Marlin. I have a question, because I think you mentioned something about how other states are trying to be on board with the same pathway. Is there a way to find out if New York or any other state will be or are in the process of getting on board with this pathway?
I guess the short answer is I would look to websites in New York. We can't
Okay.
speak for other states.
Okay, I figured. Okay, it's worth asking.
Sure.
Thank you.
And I could give you the list of states that have removed the residency requirement.
Okay, where can I
But
find that?
that's not going to tell you anything about, whether you'd be eligible or not, because the eligibility requirements for each one are distinct.
Right.
So, and these laws haven't been implemented either. So you still wouldn't be able to tell if you're eligible.
And it
No,
wouldn't
not
tell
really
you.
about being eligible, just the list of states that are trying to be, I guess, move forward with this.
We can tell you the states that have laws. We don't
Yeah.
know the states that are thinking about having laws yet. We're not
Okay.
sure.
Okay.
Amy and Rob, I can post a link to Wes's legislative database. So it's a searchable database, Norma, where you can look at what's been passed, what's pending. Although, as Rob and Amy said, you can't get the details about the implementation.
Got
But I'll post
it.
that in the chat now.
Thanks, Jeff.
Thank you, Jeff.
I'm not 100% sure, Jeff, if they are all, if it's specific about which barriers they removed.
I mean, it's coming. You can get a link to the legislation, pending or passed, and to the extent that it's clear there, that's useful information. But yeah, it won't tell you by any means the whole story, any more than ours does right now.
Right.
All right. I'm going to take about 1 or 2 more questions just because I do want to respect everyone's time and end around 8 p.m. It's been a long session so far. So really quickly, just to go through these last 3 hands that we have up, I'm going to ask that no one else raise their hand. Unfortunately, I can't read your name because it's an email, but Louis, B-N-G-Y, Louis.
Yes, good evening. So, I am a medical doctor. I was trained in Cuba, and I worked 3 years as a medical doctor in Haiti. But here, when I came here, I went straight to nursing school. I am actually in FNP, Family Nurse Practitioner. I never take like the USMLE board. I never tried. I just went straight to FN to nursing school. So now I am in FNP. I wanted to know does the nurse practitioners, so do they have to have like the USMLE in order to be like eligible, or if there's any shortcut for a provider here already in Massachusetts?
So I applaud you for retraining as an FNP, and I'm glad you're working. But no, there's no shortcut. You would have to meet all the criteria in order to get the medical license. So that's the short answer. But as we've said before, you certainly are a really great candidate for any employer.
Okay, okay, thank you very much. So just take this step while we can't apply, or maybe when it's everything ready to apply, if I already have the step 1 and step 2, I can apply, right?
Yes, that's what it
Okay.
sounds like based on what you're
Oh.
saying.
Thank you.
All right, next up, I'm going to go to Eliana. Go ahead and ask your question, please.
Yeah, good evening, and thank you for this presentation and all of the information that you have given us today is great news, and I want to congratulate for the great work that you have put into this. So and just I am very glad about the the time frame, because it's great for all graduates like myself to know that there is still a path forward. I have just one clarifying question, but I'm gonna go with my specific question first, which is, do you know if there is any specific stipulations when it comes to, for instance, if you were to apply to one of the mentorship programs for the first year and then like continue to the second and third year, are there specific stipulations, or are there not yet like kind of prescribed in the law in terms of what that means for the the physician who's going to enter these programs? I know that you mentioned it's going to be like a regular sort of contract or job contract, but what does that mean? Is there any specificity like across the board within the state in which they have to follow? For instance, they have to give you, I don't know, is it going to be a paid position? Is it going to be an unpaid position? Like I didn't hear any of that specific things, and I don't know if it's because it's still in the works, or if it's gonna go kind of depending on each of the healthcare places, hospitals, and whatnot that might be able to provide this. And alongside with that, I guess, is there any funding that is gonna come from either the state or federal funding that is going to help cover for those positions?
So Liana, the law does not provide any funding, state
Okay.
or federal or otherwise. And we expect that these positions would be paid. Absolutely. That's the goal. So you would be an employee just like anyone else. And you would be paid, and the healthcare facility would get reimbursement from your work. So if that's a short answer to your question, definitely you'd be paid.
Okay. All right. Thank you. Just to a clarifying question I had really quickly, and I'm sorry, this is also general, but it's in regards to the full licensure. When you like complete the program, the 3 years, like you can have the unrestricted. I know that you said it depends on what specialty you did in your country and like which of the areas you're gonna be kind of mentoring into, either psychiatry or family medicine. But is there any specific licensure that we're gonna obtain? No, no, right? Yeah, because I know that there was another question that came up in regards to if I want to practice in California, for instance, for whatever reason I have to move. That I know that there was a question that was brought up, and then there might be a way in which we could talk to California. But what does that mean in terms of licensure?
No, we can't control what other states do. And licensure is not a specialty. It's not specific. So
So it's just a general practitioner.
no, I don't want to say that because I don't know how again, as per other people's questions, we don't know how the board would designate your specialty on your license. It's something that we'll have to look at in the coming year.
Thank you so much.
Sure.
All right, so the last person that had raised their hand before I cut it off is Bertrude. So go ahead. You're going to be our last question for the night. So I'm going to pass.
Hi, can you hear me?
Very well.
Okay, perfect. Thank you for this opportunity. I'm really happy. My question is mostly the same as the doctor who just spoke. It's in regard of the 1 year program. I feel like we're not clear enough about it. So is it inclusively depending on us, the doctor, to go and speak with the places? Hey, do you want to hire me? And will we have like an official document to bring to them so they know what it is about? Or would they have like a meeting with MIRA so they know what is the program will be, like how they will build it? I just feel like we need more information.
Once the regulations are rolled out, they'll be able to look at the website for the Board of Registration in Medicine, the board, and understand all the criteria.
Okay. Okay, perfect. Thank you.
Yes, I think it's really important to explain that we will keep people updated through the Physician Pathway newsletter. For those who get the email, you can subscribe to it. But it's not although we want to attempt to influence the process by mobilizing our allies in the healthcare sector, et cetera, to influence the regulations, we don't, we're just, my organization is a nonprofit that advocates for immigrants and refugees, right? And so we won't have all this information. MIRA and Rob and I are both obviously working for MIRA. So yeah. We will do our best to keep you apprised of developments, but in the end, it's a good idea to keep an eye on the Board of Registration in Medicine's website. And we hope to make that website more transparent too. That's another thing we wish to influence them about, right?
Correct.
So.
All right, well, this was great. So thank you everybody so much for your questions. I know there's still a lot of things that people are wondering. I know we couldn't address everything. There were 300 of us here at one point, so obviously we didn't get the chance to answer all of your questions. There'll be updates as we move on. You'll be the first to know about any of these updates. We'll send you the link to subscribe to both the ABN and MIRA newsletters that is specific for updates on the PPA. We'll also send out a recording of this session and the slides afterwards. So if anyone missed anything, so I know there were a lot of people with questions about some of the requirements and things like that, that can all be found in the content from the beginning of the presentation. So that will all be sent out. I hope this was informative for a lot of you. I hope that you had the chance to learn about the next steps, how this might benefit you in some way. I know I learned a lot, at least in this session, so that was great. And if you have any other additional questions, feel free to reach out and we will do our best to answer as many as possible. But yeah, just to respect everyone's time, I want to say thank you and let everyone go for the night because we obviously went a little bit over. So, but I'm glad we get the chance to chat about this. So thank you all so much for being here. And like I said, any additional questions, feel free to email me later on. You guys should all have my contact, and I'll be sending out this content tomorrow morning. So keep an eye for that.
Bye, everyone.
Thanks, everyone.
Thank you, Amy.
Thank you.
Thank you all for being here.
Thank you so
Thank you.
much.
Thank you.
Thank you so much. Thank you.
Everyone. Great meeting.
Thank you so much.
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 Thank you so much.